Question 1. A 3-month-old male infant presents with failure to thrive, chronic diarrhea, and oral thrush. He has had multiple episodes of otitis media, pneumonia, and a recent viral exanthem. Lab evaluation shows lymphopenia, low T cells on flow cytometry, and undetectable T cell receptor excision circles, TREX. Chest X-ray reveals absence of thymic shadow. What is the most likely underlying cause? A. Mutation in BTK gene. B. IL-2 receptor gun chain defect. C. Deficiency of C1 esterase inhibitor. D. Gain-of-function mutation in STAT1. E. Deficiency of CD18 integrin. Correct answer, B. IL-2 receptor gun chain defect. Explanation. The most common form of SCID is X-linked, and due to mutation in the IL-2R gon chain, affecting signaling in T, B, and NK cells. It presents in infancy with severe infections, thymic absence, and low TREX. Why not the others? A. BTK mutation, Bruton agammaglobulinemia, B-cell defect. C. C1 esterase inhibitor deficiency, hereditary angioedema. D. STAT1-GUF chronic mucocutaneous candidiasis, not full SCID. E. CD18 deficiency, leukocyte adhesion deficiency, delayed umbilical separation, skin infections. Question 2. A newborn fails the TREX screening during routine state testing. Follow-up studies reveal markedly reduced CD3 plus T cells, absent thymic shadow on CXR, and absent germinal centers on lymph node biopsy. Which of the following is the most appropriate next step in management? A. Begin lifelong antibiotic prophylaxis and close observation. B. Administer inactivated viral vaccines to build T-cell memory. C. Immediate bone marrow transplant. D. Start corticosteroids to suppress immune activation. E. Treat with IVIG and defer other interventions. Correct answer. C. Immediate bone marrow transplant. Explanation. Bone marrow transplant is curative and urgent in CID, ideally performed early before infections occur. TREX screening is part of newborn screening for early detection. Why not the others? A. Prophylaxis is supportive but not curative. B. Inactivated vaccines are not effective in SCID, lack of T-cell response. D. Corticosteroids are immunosuppressive and contraindicated. E. IVIG helps but does not address T-cell deficiency. Question 3. A 6-month-old infant with CID caused by adenosine deaminase, ADA deficiency, is being evaluated. Which of the following lab findings would most likely be seen? A. Normal lymphocyte counts with elevated immunoglobulin levels. B. Accumulation of toxic metabolites causing lymphocyte death. C. Increased T-cell receptor excision circles, TREX. D. Defective class switch recombination in B cells. E. Increased neutrophil oxidative burst. Correct answer, B. Accumulation of toxic metabolites causing lymphocyte death. Explanation. In ADA deficiency, toxic deoxyadenosine metabolites build up and destroy lymphocytes, causing profound combined immunodeficiency. Why not the others? A. Lymphocytes are low, not normal, and Ig levels are decreased. C. TREX are absent or low, not increased. D. Class switching is normal unless CD40, CD40L affected. E. Neutrophil function is not directly affected in SCID. Would you like flashcards, charts, or more practice questions on related immunodeficiencies?